Welcome back to part 2 of my interview with Dr. Stefani Kappel, a board-certified and double fellowship-trained dermatologist who has been practicing dermatology for over 15 years. Now, of course, if you watched part 1 of this video, Dr. Kappel doesn't need any introduction, and to most of you, she doesn't anyways, because most of you love Dr. Kappel just as much as I do. If you're not familiar with Dr. Kappel, first of all, I will link part 1 of this video down below in the info box, but I will also link all of her information along with her incredibly informative YouTube channel down below in the info box. But without further ado, let's talk to Dr. Kappel and have her answer some more of your amazing questions. Yeah. Since we're talking about DNA damage, of course, we know sunscreen is a big one.
Sure.
I got a couple of questions on sunscreen. I know you're a big proponent of mineral SPF.
Yes.
The question was, is there like the perfect percentage of zinc oxide to get a good protection?
Right. The board answer is 7% or higher of either a titanium dioxide or zinc oxide. I feel that the best sunscreen is the one that you're going to use, with the best coverage. 7% is what the board answer is. So I always like to give that answer. But, if someone's using, a 5% mixed with other sun protective factors in it, or, a titanium dioxide that's a 5 and a zinc oxide that's a 6. I still think that that's okay, but the number that you're supposed to look for is a 7% or higher. And the reason why, mineral-based is sometimes more favored upon among dermatologists than chemical, which there's obvious reasons that I won't discuss also, but the chemical, sometimes you're piecemealing the whole UV spectrum. So when you look at the UV spectrum with the photo-damaging rays, you have UVA1, UVA2, and UVB. And if you're talking about the chemical sunscreens like avobenzone or there's sometimes gaps where they're not totally overlapping, and that could lead to UV damage coming through, versus the zinc and the titanium is kind of like a blanket, reflective protection factor that's going to have you covered. So that's myself why I'm a bigger proponent of mineral, but I don't, want to offend anybody who's more proponent of chemical or other forms of sun protection. But from my background, that's kind of where I'm coming from. And, they always say mineral-based 7% or higher with reapplication, of course, because, after 2 hours, your 7% is not a 7% anymore. So I think that's important to consider as well.
Okay, so your concern is not toxicity, which a lot of people are worried about right now, and that's why they're jumping on the mineral bandwagon. It's more full coverage.
Yeah, I am concerned about toxicity. I just didn't want to mention that part.
That's okay. We can talk about it.
In and of itself, the toxicity is a concern for myself as well. Yeah. But in addition to that, for the obvious reasons, I think that understanding the full coverage is really important too. And also, sunscreens that are chemical absorb versus reflect like mineral. I just feel like it's, a little bit safer mechanism of action, but that's what also gives us that kind of like white, sheeny, shiny contour. But I think it looks beautiful. That doesn't bother me at all. I'm very proud to walk with my shiny, like white zinc oxide covered face, even if we're on vacation or on the beach. And I actually set a timer on my phone for myself and my family and my kids to reapply. And, it's sometimes easy to forget. So that's really important too.
But that's something I appreciate about you as well. There are so many dermatologists that are going a bit overboard. They're walking around in a burqa basically, and with an umbrella. And it's like, we also have to live our life.
You have to live your life. Absolutely. And I'm actually probably get a lot of slack from my colleagues about it. I mean, we live in Newport Beach, California. Just this morning at 6 a.m., I was with my son. He's on the surf team and he surfed before school from 6 to 9. And I was, putting on my sunscreen and I took him to school, but we live on the beach and I want people to know that you don't have to hibernate and hide and protect yourself. I mean, I played beach volleyball and surf and swim with my kids every day, like on the beach. We live right on the beach. And I feel that at 47 years old, spending my whole life on the beach as a dermatologist, I've been very diligent about my photo protection. And, it's just kind of a testament to say you can live your life, you can be in the sun, you can enjoy your outdoor activities, and just be smart about it. And, you can definitely enjoy some fun in the sun. Sometimes I see my colleagues doing that. They'll be in a full on wetsuit. Sometimes when our dermatology meetings are in Hawaii and they're in a full wetsuit, and I'm just like in my bathing suit running around with my kids, of course, covered in sunscreen with my HelioCare. But, it definitely, you need to live your life too, because that has an outward effect on your skin, decreasing your cortisol levels, decreasing your stress, happiness. Like it's something that we kind of don't think about, but it really plays an impact on our skin and our overall skin health as well.
Exactly. Now, do you feel that titanium dioxide is a broad spectrum filter, or is it more of a covering B? Does it get the A rays as well?
I think it covers a little bit more B. I think out of the two, zinc oxide is definitely more broad spectrum. So if I had the choice between the two, I prefer zinc. But titanium does cover a little bit more B, which is more important for skin cancer prevention. But I think for full coverage for anti-aging, UVA 1 and 2, and the full throttle, I think zinc is kind of as we say, the GOAT of the sunscreens, the greatest of all time. So the kind of main player.
And people with melasma, would you say mineral sunscreens are better because of the
reflection? Yes. I feel melasma can be challenging because I do have some patients who just avoid the sun at all costs, and still, from just the heat from hot yoga or, blue light from our devices can ignite the melasma, or if they're using at-home devices, sometimes that can. So there's a lot more than just the sun for melasma, which is unfortunate because, you also want to do your daily activities that bring you joy and not impact your quality of life. But I think for the most part, mineral-based and zinc oxide-based sunscreens for those with melasma is really, really important.
Okay.
Also, if they have any, iron oxides in it too, because the environmental toxins and pollutants can sometimes, affect melasma flares and so forth. So that's an important component to look for in a sunscreen as well.
Now, you just brought up at-home devices. We'll jump to that in a second. But one more thing on sunscreens. The question was, how do you feel about Korean sunscreen? You mentioned avobenzone and oxybenzone are quite limited in the United States as far as filters.
I feel the US is so behind with our updated technology. I am a proponent of Korean sunscreens. And again, even ones that have chemical based sunscreens, I just feel that, to each his own. And I feel that it's all a balance based on, your fear factor or your beliefs or what you've come across in your own research, what is, safe or not safe. But I'm not against Korean sunscreens. I think that we should learn from them as a country, that we need to update, our research and our scientific investigation of our scoring system, which is completely arcane, the way that we score our sunscreens, and can learn a lot from, Korean sunscreen and sunscreen care. So I think that, I am an advocate. Again, being more mineral based, I'm kind of in a tough spot, but I'm not opposed to it. Let's say it that way.
And I think, to my knowledge, all this toxicity scare is around American chemical filters.
Yeah, the filters are different. So you're not comparing apples to apples. So it's hard to say. Yeah, definitely.
Now, you just brought up at-home devices. I had a ton of questions on at-home devices, and we can't go into every single one of those because there are so many of them.
Right.
But how do you feel about at-home devices? Do you think it's worth somebody's time, money?
There's so many at-home devices that are so diverse with their mechanism of action and claims that, again, I'm very open-minded as a provider. And I say, if something is working for someone and they're happy with results, then by all means, go for it. I always say just proceed with caution, because they can be very expensive and they can be very time consuming, and they can become expensive not only with the device itself, but kind of the consumable that the company has you return on subscription to keep up with to make the device work. So just being aware that that's out there, and that there's really no FDA. There are a few FDA approved devices, but I forget the name that they use, but it's not FDA approved, but it's FDA cleared. There's a big difference. You want to go for FDA approved, not FDA cleared, because the scrutiny of the, to pass the safety test is a lot different. For the ones that are really, really expensive, I always say, if you could demo it or, have like a trial of it and look at the return policy if it doesn't work. If there's not a good return policy and it's very expensive with not a lot of data or, FDA approval supporting it, I always say just proceed with caution. So I think that there are at-home devices that can be very meaningful and worth it, but I feel like there's a lot that can not be and can be a big waste of time and money and false promises, and then just you're let down, and that feeling of being overpromised a result and being let down. I don't think there's anything worse, and it's just you're out of I don't know how many hundreds of dollars, and you're not happy with the results, and it's just not a good feeling. And then you call to return it and there's no return policy. It's just a bad position to be in. But I did a recent YouTube video on at-home devices where I kind of looked into it. The only thing I really want people to keep in mind is that because of the heat, sometimes, it can increase hyperpigmentation, solar lentigines, or brown spots. And I see a lot of patients in my office who will come to me for laser treatment of their brown spots or hyperpigmentation, and they usually associate it with a new onset use of an at-home device. Mm-hmm. So just be careful if you're getting hyperpigmentation that it may be coming from that device. So just kind of keep that in mind. But for the most part, there's some people who really love the devices or the, microcurrents and so forth. So I think that I don't want to say yes or no. I just think that every individual is different. Every device is different, but just knowing, where the pitfalls are and how you can get caught in a trap is really important, just to empower people to think of that as a consumer before they spend their hard-earned money on a device.
Yeah, I will link your video down below where you talk about the at-home devices, but I have a whole basket of at-home devices I was sent by a company. And the way it works, and this being on YouTube, they'll send you a device and say, oh, when can you make a video on the results next week? And I was like, no, I have to try this for like 3 to 6 months to see if there are any results. And 99% of them I never talk about because there are 0 results.
Right.
So it is kind of, but unfortunately there are some dishonest people out there that claim, oh my God, this has changed my life. And so people buy into it, and it's really unfortunate.
I feel that I feel that was kind of my impetus for starting YouTube. And nothing against sponsorships. I think they're great, but like my own colleagues who do sponsorships for at-home devices that I know they don't use, I know they don't recommend for their patients, but they're getting a big check, when they say these devices work. And even at meetings, I'll say, Dr. So-and-so, why did you say it? It's like, I don't know. I'm not seeing patients anymore. I'm just a full-time YouTuber now. And I'm just like, it just really is disheartening to know that, that's going on out there. But I know a lot of my own colleagues who recommend the at-home devices who do not use them, nor do they recommend them for their patients. So just keep that in mind. As with anything, there's a lot of marketing, and it's an industry that's kind of has a large influx of that right now, but just making wise decisions for yourself, I think, is really, really important, and empowering people to kind of know what questions to ask and what to look for, I think was really important. And that's awesome that, you have that integrity. I really respect that. And it's lacking in today's world. So a
good night's sleep is much more important to me.
Exactly. You want to sleep well, feel good about what you do. That's the most important, so definitely.
There are a couple of home devices I do like. I can't tell you that they've changed my life, but I like them, and I do think that they make a small impact. Nothing like in office, obviously, but it's something you can do at home in the privacy of your own home. Right. But there are very few that I think are worth the time and money, definitely.
And I think too, also, sometimes it's an investment. So like if you're going to get 24 hours of a result from an at-home device and have to do it day in and day out, most of the patients I see in my office are like, I don't want to think about it. Come in, do your thing. Like say if you do a treatment, it's good for 5 years. You don't have to think about it. You come in every 5 years, you do it, it's done. It's a little bit more intense, but doing that every 24 hours and having results that are temporary and go away aren't usually what my patient population is looking for. They're just like, do it once. I don't want to have to work that hard. I don't want to think about it. I don't want to be at dinner and all of a sudden my results go away.
Yeah, that's my fear. I really love the zip. That is one of my few, but it broke the other day, and I thought, oh no, now everything is going to reverse. So yeah, that is definitely a fear. It is something just like exercise you have to do on a regular basis.
You have to do it over long term. Yeah, definitely.
Now, you were talking about hyperpigmentation, and that seems to be a big problem. And I never have much advice on that because it's luckily something I haven't struggled with. I've had every other problem with my skin, but hyperpigmentation. What would you say are some good in-office treatments, and then also some good at-home topicals people can use?
Right. So in office treatments, lasers are the mainstay of therapy for correcting hyperpigmentation. And there's different lasers to treat hyperpigmentation depending on the depth. You can have superficial, mid, or deep, or a combination of them all, and also different skin types. So a large part of my patient population are darker skin tones who come in to see me for laser treatments who've been told by other providers that they're not candidates for lasers. And that's absolutely not true. Sometimes that just makes me sad to hear that, people were turned away from laser because of their skin type. You just have to know the right laser, the right settings, the right wavelength, and the pre and post care. And absolutely, lasers can be safe and effective treatments for melasma or hyperpigmentation. Oftentimes, it may be a combination of different lasers. For example, like a pico laser for some of the spot treatment of the more dark sunspots, and then an overall Fraxel or pico toning or clear and brilliant for evening out kind of more diffuse, ill-defined hyperpigmented patches. But usually it's in conjunction with skincare as well. So what we do, I always say what we do in the office is kind of like working out and using skincare actives at home is like eating clean, and they synergistically work together for like a 1 + 1 = 3 response. And so usually it's stabilizing the melanocytes, the pigment producing cells in the skin, to help make sure that the ones that are producing too much melanin too fast are kind of suppressed, and making sure that the melanin, when you look at skin under the microscope and you see, beautifully glowing skin like your own, you see all the melanin in the same dermal plane. When you look at melasma under the microscope, let's say somebody has patches of brown spots, under the microscope on cross section, you'll see dense melanin, no melanin at all, melanin just down here. And it's very checkboard pattern kind of look to it, which correlates clinically with kind of dyspigmented skin. And so when you use actives that are going to suppress the melanocyte activity to get all the melanocytes producing the same amount of melanin in an even distribution, it really brings the whole package together and gives next level results. So you kind of correct with the lasers and then give the right actives for aftercare, which may vary depending on a person's skin type and some other factors too. But those two are usually the main ways to treat hyperpigmentation. And I always say it's harder to get from point A to point B to get to your results. Maintenance is a lot easier thereafter. It's not as much work. It's kind of like training for a fitness competition. Getting ready to compete is hard, and then maintaining those results aren't as hard as it was to get there. So I always say that as well. And at-home treatments can be really helpful too, by just maybe using some skincare actives. I know a lot of people ask about at-home peels. You have to be just really careful with at-home peels, because although they're an at-home treatment for hyperpigmentation, they can cause, chemical irritation or contact dermatitis, which then results in a post-inflammatory hyperpigmentation. Then you're kind of chasing your tail and creating more pigment when you're trying to treat the pigment in the first place. So, at-home treatments like at-home peels sometimes can be beneficial, or just using actives that are going to, target that melanin synthesis pathway, like a glycolic acid, a lactic acid, vitamin C or retinol, whatever works best for your skin. You can do a lot at home, with treating with actives, and then also, photo protecting yourself with sunscreen, not only when you're outside, but if you're going to be on your computer at your laptop for a while at night and you see the blue reflection on your face, it's really important to, you wear sunscreen sometimes at night when you're working. I know that may sound a little silly, but, sometimes that's what needs to be done to really control very recalcitrant melasma.
Or put your blue block on. Most of
Yeah,
us
put your
just have it.
yeah, or put your blue, or change the settings in your phone for warmer. Yeah, definitely.
Okay, that's good to know.
Yeah.
Now, one more question on topicals, and you also made a whole video on that, so I will link that down
Yes.
below. But there's a lot of talk right now on topical estrogen for skin aging. We know how much estrogen loss affects our skin.
Yes.
How do you feel about topical estrogen, and also how do you feel about HRT as far as preventing, or not preventing skin aging, but helping, counteract some of the skin aging?
Right. I actually did a recent YouTube video on topical estrogens and just estrogen depletion syndrome in the skin as well, where I kind of took a deep dive into this. But kind of in a nutshell, estrogen, we know estrogen depletion, when our estrogen, levels decrease, it has an effect on our skin. The skin gets drier, the barrier becomes compromised, collagen and elastin stores decrease, the skin gets, wrinkled and laxed. So you would think that applying a topical estrogen on the skin may reverse those changes. From my research and investigation, looking into it and speaking with other leaders in the field of, women's health and women's hormone replacement therapy, what we've noticed is that the answer for reversing the effects isn't as simple as just putting a topical estrogen cream on, because estrogen also can have some deleterious side effects in the skin. It can increase hyperpigmentation. It can increase telangiectasias or vascular growths in the skin. Even just if you look at during pregnancy, we get the mask of pregnancy, and we get, increased blood vessels. Our moles get darker. Certain areas of our body get more hyperpigmented. So it can sometimes have side effects in a negative way when directly applying topical estrogen on the skin with respect to vascular growth and hyperpigmentation. Having it systemically in the body can definitely offset the changes that you see from estrogen depletion. Now, why topical application has a different effect than systemic estrogen into the skin is not as clear. But I feel that even my own women's health provider, I'm 47, but I'm still on the birth control pill that I've been on since college. And my body is very good with that hormone, with the exception of my 2 babies and breastfeeding. I was off of it, but on it, I feel like that's helped me, kind of fight and combat the effect of estrogen loss that I'm probably going through at this moment. And I feel that in speaking with my OBGYN, her name is Dr. Gigi Kroll. She's amazing. She has told me that if anything, this is going to help you, with your skin long term. And the effects of estrogen going through the bloodstream and affecting the skin can definitely have a profound effect. But the direct application, I don't know if it's because of the absorption of it, or, we always talk about locking keys for active ingredients to get into the skin. It may not be opening the right doors when going through that application delivery system. So, for a long answer to your question, I'm sorry. I think that HRT can be very beneficial to the skin. That also comes with, some possible side effects that are controversial now. I know there's a large swing in the way that doctors and providers are approaching hormone replacement therapy that differs very greatly from generations past, where, our mothers had to suffer through the stages of menopause and, kind of just grin and bear it. Now they're kind of swinging the other way, looking at some of the data and reanalyzing some of the misconceptions or thoughts we had about HRT in the past. So I think that HRT can be very beneficial to the skin, and maybe just a direct topical application to the skin may not give the same effect.
Mm-hmm. First of all, don't ever apologize for long answers. I love your answers. Personally, I'm throwing everything but the kitchen sink at it.
I love it. I can talk to you all day.
So I'm on HRT, but about a year and a half ago, I also started using topical because the studies looked promising.
Right.
I agree with you. I think that systemic is probably more natural. And, it's just like, I think if you have enough systemic estrogen, for example, you don't have vaginal dryness or anything. So you don't have to address that, with a vaginal estrogen.
Right.
So probably the same is true, I would think, with the skin. But like I said, I'm throwing everything at it, hoping there'll be an effect. I can't tell you it's done anything, but I can tell you is that I don't have any ill effects from it. I don't have any side effects. My hormone levels haven't changed from it. But I also can't tell you that it has done wonders for my skin. It's just something I looked at the studies and they look promising.
Yeah.
So, but I appreciate that you mentioned the side effects, because that is good to know.
Right. Yeah. And I mean, whenever we would look at a skin biopsy from a woman during pregnancy, and we would look at the histology, say example, we're doing a biopsy to rule out a melanoma on a mole, and the woman's mole looked like melanoma under the microscope. So all the derm residents would be like, oh my gosh, it's a melanoma. Like, no, she's pregnant. Remember, all these cells look a lot worse than they are because of the hormones. So that cells look and behave differently when they're exposed to hormones than they usually would otherwise without that exposure. But you're going to have increased pigment production. You're going to have increased cellular activity that may not be the benefit that you want. It's all the bad things you don't want, the skin tags, the hyperpigmentation, the blood vessels, telangiectasias, things like that. So I think that, and I do think, to your point, having systemic absorption of the estrogen, it's opening up different doors with different pathways and different locks than just putting it topically on the skin, because I feel that there's other options that may be a lot more effective without the side effects of a topical estrogen cream. If your goal is to, say, for example, increase collagen synthesis or have, anti-aging effects, I'd much rather have a tretinoin or a retinol than an estrogen cream if you're going a topical route.
That makes sense. That's good to know. So you are, even though you use retinol in your own serum, you're a proponent of retinoid acid.
I am, yes. A prescription. I personally use a prescription strength tretinoin maybe once or twice a week. And it's not for everyone. And I think that as long as you find the vitamin A derivative that works best for your skin, but the data is very overwhelming with respect to tretinoin as a skincare active. And I feel that sometimes it may get a bad rap because people may not use it appropriately or go too much too fast. And I think there sometimes it is a misconception that, people say it thins the skin. Well, it thins that stratum corneum layer off, which is the dead skin cells sitting on top of the skin. That definitely thins out, but it reveals fresh, vibrant, youthful skin underneath. You don't want that layer to be thick. You want the papillary and reticular dermis to be thick. And that's what tretinoin does, because it increases synthesis of collagen, elastin, glycosaminoglycans, all those structural support proteins that we lose that, over time can give us lax skin. It kind of builds that back up. So it thickens the right part of the skin and it thins the part that we don't want anyway. So
this is something else I appreciate about you, because I think this rumor was started by people that come out with retinol or retinaldehyde serums. So don't use tretinoic acid, it thins your skin, but you have a retinol serum and you still tell us the truth, which is what I really appreciate about you.
Yeah. And the funny thing is too, when you look at the pathway, like in a biochemistry course, when you look at the retinol, retinaldehyde, and retinoic acid, the conversions are going back and forth in the skin. There's two arrows there's two heads on the arrow, meaning those enzymes convert back and forth to each other. So even people who apply retinaldehyde to their skin, a portion of it is getting converted into retinol and vice versa. So, the skin's very dynamic, ebb and flow, kind of fluctuating organ system. And it's not all hard and true, when you see these claims on skincare products. That's just not how science is. And that's not how the human body functions. So it can be sometimes misleading too.
Yeah. A question I personally have on retinoic acid that I can't find an answer to. Would you say that also has DNA repair properties?
It does. Yeah, it has been shown to. That's one of the many properties of it.
Okay.
It binds the receptor. There's all these signal transduction pathways that happen in the cell, and there is a DNA repair enzyme pathway that it gets upregulated with retinoic acid.
That's great to know. A couple of questions I had on spider veins, and I have that same problem. I actually, when I lived in Paris, had 2 V-beam lasers done on them, and it didn't do anything. So what would you say is a good treatment for spider veins?
So funny you should ask. So for spider veins on the legs, you would never want to do a V-beam. The only things that work on the legs are endovenous laser, where a laser is on a cannula, goes inside the vein to ablate it, or sclerotherapy. Totally different than the face. If you have veins on the face, you can do V-beam all day long. And the reason why is because sometimes it's not as effective, and it also can cause post-inflammatory hyperpigmentation in the outline or like a silhouette of where the vein was. So even if the vein's gone, you have this hyperpigmented branching venous pattern on your legs. So usually for leg veins, sclerotherapy or endovenous ablation with the laser is a little bit more involved, and I think beyond anything that would be needed for like little pesky veins on the legs. But sclerotherapy is the mainstay of treatment for spider veins on the legs. V-beam can be used for those little pesky vessels on the face and around the nose. Usually the way it works for sclerotherapy on the legs is the sclerosant. There's various different types of sclerosant agents, but you inject it into the vein, and on the vessel wall it causes irritation, and so the vessel walls kind of collapse and scar down, And that's why usually you have to wear compression stockings for about 2 weeks, maybe 1 to 2 weeks after the treatment to keep those vessels collapsed. And then your immune system kind of comes and degrades it away. That's usually the most impactful treatment for leg veins. And it's kind of a downside that you have to wear those compression stockings, but compliance and wearing those stockings is really important too.
Have you seen it not work in some people? Because I did have a consultation for that, and I was told that my veins were too tiny to inject.
Oh, no.
Have you heard that before?
Usually that may be a person who isn't as comfortable with cannulating the vein. I usually refer to my vascular surgeon colleagues for that because they can use loops and devices and they can cannulate those little vessels really, really well. Because that in order for it to work, you have to get the sclerostin inside the vessel. When they're super tiny, it can be challenging, but it definitely can be done. And I usually defer to my vascular surgeon colleagues because those guys are really great at cannulating those veins, and they can also actually use a stronger sclerostin that I myself as a dermatologist can use because it's beyond a little bit my scope of practice with the skin. They can kind of use the more aggressive, stronger sclerosins that I wouldn't even want any business using because sometimes you can have side effects and ulceration and things like that when it's not used appropriately or it's too strong or too much. But yeah, it can definitely be done. I can give you a referral to a vascular surgeon who's down the street from me if you want.
That would be great.
He does mind.
It's something it's a superficial problem, but it is kind of unsightly.
No, for sure. It is a hassle and you have to stay on top of it. I even get my veins treated like once a year. So I'm ready for the next summer. Every winter, I go through my little process of just, getting the little pesky veins. So over a lifetime, you don't accumulate more and more.
Yeah, that's good to know. Now, I so appreciate all your time. I have one more, like a group of questions about the eye area. So under eye area, good treatments for that, as well as upper lid, any sort of alternatives to, I can never pronounce that surgery. What is it?
Blepharoplasty. Yeah. So I perform blepharoplasty in our office. As a matter of fact, it's in this room, usually an outpatient procedure. But for those who don't want surgery, which is, I would say 90% of patients, there's things that you can do to stimulate collagen to tighten up that skin. Thermage is one of my favorite treatments for treating either lower eyelid or upper eyelid laxity or lack of collagen. I've done it 4 times myself. I did it at 30, 35, 40, and 45. It's good for about 5 years, and it just increases collagen stores, which helps keep the under eye smooth and the upper eyelids tighter without surgery. And I think that's one of my favorite treatments because it's long lasting, it's not painful, doesn't melt the fat when it's done the right way. You have to find a provider who offers it because a lot of providers will say, oh, that's not an area where we treat, because you have to be able to put in an intraocular eye shield, which takes an extra level of skill. And you need a Thermage handpiece that's specific for the eyelid skin because that skin's so thin. The transducer on the Thermage, it has to be a very tiny little arc to get that radio frequency where you want it to be. It can't be too deep because if you're using a face tip on the eyelid skin, that would be a mismatch and wouldn't be appropriate. But Thermage is probably one of my favorite treatments for that, and people do it all the time to keep the under eyes nice and smooth and tight. Sometimes we'll do a resurfacing laser on top because Thermage is like a deeper stimulation of collagen, and when you do laser on top, you kind of get full thickness, and for that we call it thermofrax because we'll use Thermage and Fraxel, or we could use a CO2. There's various options, but the end point is to always stimulate more collagen because the more collagen you have, the smoother and tighter that skin is. And I think that in the past, we're coming out of an epidemic where people were using filler for the wrong reasons. And there's nothing worse than trying to treat wrinkles under the eyes with filler because you're just plumping up the tissue and stretching it out. And then over time, you're going to start looking, your eyes will be smaller and you'll be deformed looking over time. So I'm not a proponent of filler for under eye wrinkles, but definitely Thermage and lasers. And also you can do chemical peels around the eyes. You just have to be very careful, because there could be a high risk of corneal abrasion and other things if you're not going to someone who is an astute provider with a high level of skill and training just in treating periorbital skin.
Mm-hmm. Good. I lied, actually. I have one more group of questions, and that's about jowls, which is I think aside from the under eyes, that's everybody's problem is jowls as we age. Jowls,
Right.
the perioral folds, all of that.
Yes.
The jawlines, that is the thing that I have the
Yours
perioral
is
folds.
snatched, by the way. You do not have any
My
jaw.
jawline, that's the German jaw. I'm lucky, but this stuff here, I always go, this looks so much better. But what's your treatment of choice for that area?
So it depends. I really like Thermage and Elecore. So, Elecore is a little bit more controversial. It's the new revolutionary microcurrent technology to help shrink wrap the skin. You're basically taking little punch biopsies out of the skin. It's like a skin excision, and it kind of just snatches the lower face. It's FDA approved for the treatment of mild to moderate rhytids of the lower face. I usually go with Thermage first because it's a one-time treatment. There's no downtime. It's not painful when done right. And it really can just rejuvenate that area. And I'm, a proponent of it myself as a patient who's done it every 5 years since I was 30. It's really, I think, helped me here for someone my age. But Elecore is for patients with a lot more laxity and thinner skin. But I always say, let's do a Thermage first because you're going to put heat in the form of radio frequency to stimulate collagen through that mechanism. And then if you want to tighten on top, you can always do Elecore, but Elecore doesn't stimulate collagen. It just kind of removes skin. Mm-hmm. So you can kind of think of it almost like a surgery. Whereas I like Thermage because you're inducing your body's own regenerative processes to fix the problem with longer lasting results. So, Elecore and Thermage are my two favorite. I usually go in that order, or if someone has like a lot of laxity where even stimulating collagens, I'm not going to give them the results they want. We'll usually recommend Elecore.
I actually talked to a friend of mine who is a cosmetic radiologist, and we had this discussion about Elecore. And this was just a theory of hers, but it kind of made sense to me. And I'd like to get your input on this. She was saying, so you take little tiny pieces of skin out, right?
Right.
And if you don't really compress that skin in her, thought process, it would be replaced with scar tissue, meaning you wouldn't necessarily tighten the skin, it would just be replaced with scar tissue.
Right.
How do you feel about that? Is that something that makes sense?
Yeah, so they investigated it. Actually, one of the engineers and the person who discovered or came up with the idea of Elecore was Dr. Rox Anderson out of Mass General Wellman Labs at Harvard, who's actually one of my mentors. And we talked about this. I actually participated in the clinical trials back in 2017 when Elecore was first launched. And we would do a Tegaderm dressing. Tegaderm's kind of like almost like a adhesive that closed the holes. And we did a comparative analysis of using Tegaderm and non-Tegaderm skin, and there was no difference. So we actually looked into that. And because there was no difference, we noticed that there was an increased upregulation of these myocells, which cause wound contraction. So the skin kind of does it on its own without the mechanical closing of the holes. So you get a little wound contraction at the same time, which is what closes the holes and also tightens the skin a little bit. So we actually looked into that. So that's a genius, question to ask, which we actually investigated.
Because if you just think about it, without diving too deep, it kind of makes sense. But I'm glad you looked into that.
Yeah.
What about people that tend to have hyperpigmentation? Would Elecore be an option or no?
Right. So it's FDA approved for skin types 1 through 3. So I personally have treated skin types 4 with post-care with hydroquinone and some non-hydroquinone skin lightening actives. But because it's FDA approved up to skin type 3, that is always a risk that we worry about. So if you have beautiful olive skin tones or darkest skin type, we usually will go with a different modality because hyperpigmentation can be a risk of Elecore, which is actually not at all with Thermage, which is another benefit of Thermage too. Again, I'm not sponsored by the company. I just love the device. And I get great results and have very happy patients with Thermage. But Thermage doesn't have a risk of hyperpigmentation, but Elecore can in darker skin tones for sure.
You keep getting my brain going. Now I have one more question.
I love
Thermage. Let's say if I would want Thermage, I spend thousands of dollars on biostimulators. Would there be any risk that they would melt, be destroyed?
No, not at all. That's a great question. They all work synergistically with together. And if you have we combine biostimulatories with Thermage all the time, and there's no contraindication or risk of the biostimulatory agent or effect being compromised. Even dermal fillers with hyaluronic acid fillers too, that comes up a lot. Is Thermage going to melt my fillers, or is it going to affect my Botox? And the answer is no. That's a great question though. But yeah, you don't have to worry about that.
That's good to know.
Yeah.
Well, Dr. Kappel, I'm sure once I put this video up, there will be 1,000 more questions.
We have to do this again.
Hopefully you will come back. I had so much fun talking to you.
I know, it's so great talking to you. You had such amazing questions. Your subscribers have so many insightful questions, and I just love it. I could talk about it all day.
They love you. When I posted on my community page that I was going to talk to you, people were like, oh my God, I love her.
Oh,
so,
thank you so much.
Very well liked.
Oh, thank you so much. And you're just wonderful. I could talk to you all day. I'd love to do it again.
So yeah, I would really appreciate that. And you're really a rarity in this space because you are so honest. You do have your patient's best interest in mind, which is very apparent.
Yes. Yeah, I'm very passionate about that. And I think as a consumer and a patient myself, like I'm just very empathetic to, my patients and just want honest and true information. And I see, the things that go on in the industry, and it makes me sad that it happens, but it gives me more impetus to have a YouTube channel and just have this, safe space where people can come to for, true and honest, unbiased information. So same with you. I'm so glad that we were able to meet and cross paths.
Yes, and of course, people can come see you in person. Thank you so much for your time. I really appreciate it, and I appreciate you and all your knowledge.
Thank you so much. Thank you for having me.
I really hope you enjoyed this interview with Dr. Kappel as much as I did. I had such a blast talking to her. I could have talked to her all day long. She is not just wicked smart, but incredibly sweet. Now, of course, if you have any more questions for her, please leave them down below. I'm really hoping we will have her back on the channel soon. And I will link all of her information along with her incredibly informative YouTube channel down below in the info box. So if you're not already familiar with Dr. Kappel's YouTube channel, please make sure to check it out and subscribe. And again, any questions or comments, please leave them down below. Always love to hear from you. Thank you so much for being here. Until next time, bye.